performing an endoscopic Deuk laser rhizotomy to treat pain from a facet joint. And our patient has facet joint pain at L3-4 on the left and L4-5 bilaterally. So we're going to rhizotomize or destroy the medial branch of the dorsal ramus. Why didn't we white balance already? We didn't white balance. No. You got to take it out. Take the scope out. Are you still on the transverse process? All right, so this patient has facet joint pain. We've talked about this before, and we're close to the facet joint. Those look like muscle fibers. So you're probably, the muscles do attach to the facet capsule. So we're probably, that looks like fat there. You feel you're on the right spot? No reason you can't bring, you feel bone down there? So when we get done with the procedure, I'm going to come up over there and show you guys exactly where we're working. You're definitely on TP, right? The nice thing is you can feel it with the side-firing laser. You can just go down and hit the TP and make sure you got TP below the fat. Tell me if you feel TP. You do? All right, so get it. I would start at the top and come down. Make sure there's your targeting beam. Yeah, don't hit the side of the tube. What's going on? Fluoro, move out of the way, Luis. Just hold it and move to the side. I would hold the camera once you know where you are. Shot. That's it? What do you think? Yeah. All right, thank you. You can pull the fluoro back just a little bit. So we're going after the left L3 medial branch of the dorsal ramus. What you're seeing is the laser fiber. I would start at the top, Bharat, superficially, and work your way down. Yeah, you're going to have to twist that thing more. You want to get rid of the fat so you can actually see what you're doing. Let me have the grabber. You keep the laser, I'll grab it. You just keep that tip of the tube on the target, and I'll grab the fat out for you. So Dr. Patel and I do these procedures together.
Please, thank you. Yes, thank you.
That looks like the nerve there, huh? It'd be nice to see the facet, the lateral wall of the facet. So if you can do that, that would be great. You need to twist it. No, you got to twist it around. Yeah, around. 180 degrees. There you go. Once you identify the bone, the lateral wall of the facet, then you just move laterally from there. If the fat gets in your way, let me know. Okay, no, do not keep the laser on as you come out. Did you do that? You did. You did. Look what you did. You knocked the lens out. Fucking hell. Are you serious? Here, you knocked the.
What's the thing? No, no, but can we use a normal right now? And this one for the next case? Huh?
I understand your point. Let me see. Come out for a second. Maybe it's just something on the end. Maybe we can wipe it off. Who knows? Let's just see. Go. No. Fucking hell. Yeah, we're gonna have to use a normal one. Bring another one.
Yeah.
This is.
Can I have a normal one? Yes.
This is.
Number 2 lumbar. Yeah.
Let's turn off the irrigation right there.
Scope off, please. Scope off, please. Thank you. Lights on, please.
Hold that. So what we did was we blew the lens out of the scope, which can happen. We just have to go to another scope. The scope can be repaired, but it can't be used until it's repaired. That's fine. We're gonna use a different scope. I'll take over for a minute, but all right, connecting the irrigation. Light source. Thank you. All right, let's see where we are. All right. Got irrigation on?
Irrigation, please.
Why is my irrigation not on? Come on.
There you go.
What was the issue? We need to do another fluoro.
Fluoro, please.
No, we need to bring the fluoro in. All right, so go ahead and get that back in position, Marat.
Scope off, please. Monica, please. Thank you.
Go ahead and put that back where you want it. Is that the shot? Coker? Shot?
Yeah, please. Yeah.
Too medial, you think? Shot? So why am I not seeing the TP? Shot? Probably right there, huh? What do you think, Bada? You're too rotated. You gotta you gotta make sure your spinous processes. Shot. Other way. Shot. Too much. Just to go back a little bit. Shot. Shot. Hold on. Shot. Shot.
More racing, please. Thank you.
Shot. I can't get more medial. I think that's it, right? Okay. Fluoro out. The key is to not move this tube. That's the hardest part about the surgery. Turn on my irrigation. Luis, turn it on. Yep. Thanks.
Scope on, please.
Scope on. All right, so Let's see the laser fiber. That's going to be a longer, right? We're going to need a longer or what? There we go. So you see those 3 bars, Bada? Those 3 bars are where the opposite of where the laser fiber fires. Does that make sense? And there's bone right there. So the key is to not let the laser hit your inside of your scope, where your lens is. Otherwise, you literally create a scope that can no longer be used. Now, see that right there? That may be the nerve. I just zapped it. You see that? But I want to make sure, so I'm going to keep going. Because right now, that's the side of the facet. And if I just keep going, I can clear this tissue off. Sometimes, I think that's the nerve right there. Sometimes the nerve gets caught under a bony ledge, like right here. You guys see that bony ledge right there? So I could take down the bony ledge, and I could work underneath the ledge and get the nerve, like I'm doing right now. But that's the side of the facet joint. I want to just go a little bit more lateral. I'm going to turn the laser. Notice how I keep my tube of my lens and everything far away. Okay, otherwise all the money you make is going to go towards repairing scopes. You don't want that. Okay? These scopes are very expensive to repair. So you got to protect your scope from that laser. The laser will literally destroy your scope. So we're heading down the transverse process right here. Pretty much done. That may be some nerve fiber there. Yeah. So I'm just maneuvering the laser. I think that's it. I mean, you can see the lateral wall of the facet, and then you can see the transverse process here. And I've cleared all the soft tissue pretty much off the transverse process. So she's moving a little bit. So the nerve was somewhere right around where the tip of this was. And that's the transverse process right there. You see it? And this is just a little bit of fascia. So I think we're good. If I can get a little more, I will. I think we're done. That's it. Yeah, I don't see any more nerve. It's gone. We're done with this level. Any questions from our audience?
No, sir.
Scope off, please. Thank you.
You see how I did that, Bharat? Come on in. Dr. Patel and I do these procedures together. So patient gets 2 for the price of 1. Endoscopic rhizotomies for the lumbar spine are a newer type of procedure. We're going to start doing cervical next. We have our first patient coming from England, and she knows she's our first patient. And I don't know when we're doing her surgery, but what? Is it Thursday? Oh. Okay, Thursday. So to treat the L3-4 facet, you need to to go up to the L3 transverse process and down to the L4 transverse process, right? You are right. Right, Monica? So if you want to treat the left L3-4 facet joint because it's causing pain, you want to do a rhizotomy of the left 3 and the left 4. So at the transverse process of 3 and at the transverse process of 4. So you need to deaden 2 nerves in order to treat one facet joint because each facet joint gets 2 nerves innervating it. And if you only denervate with 1 nerve, then you're not really getting rid of all the pain. So you need to do both nerves. So each facet joint is 2 nerves that have to be rhizotomized or killed with the laser. And we have a new technology coming. It's actually plasma. Plasma. Ooh, is right. What's better than laser? Sometimes plasma. Y'all know what plasma is, right? If you've ever watched Star Trek, you know about the plasma cannons, right, Dr. Patel? So we're going to be using plasma energy to treat pain. That's coming in the next few weeks. Nothing wrong with laser. But plasma allows us to treat a little different, that may be a little bit more efficient. Any questions from the audience about this Deuk endoscopic laser rhizotomy, DELR?
No, sir.
Are you happy with the positioning? All right, then hold it down and don't let it move and bring your scope in. And let's get the fluoro out. So move your body a little more to the left. And yeah, so look how far down you are with the scope. You're too far down. And you need your irrigation. Yeah, if without irrigation, you're not going to see anything. Because there's always a little bit of blood. Go down, down, down. There you go. Now come up and hold it right around there. And the way you hold it is with one hand. You hold it right at the junction of your tube and the scope. You have to do it with one hand. There you go. And pinch it and hold it. Don't do that yet. Let him just get situated. But you've got to keep the tube on the transverse process. Once you lift off the transverse process, then you don't know where you are. You got to start all over again. Okay, Bharat? So are you where you want to be? Are you 100% sure? Huh? I have no idea. Doesn't matter. All that matters is you use the X-ray to find the docking point on the TP at the lateral to the facet. And if you pull the scope out, I would pull the scope out. Yeah, let Luis help you. And turn off the irrigation and just focus on that tube. Once you get the tube where you want it, then don't let it move. Go ahead. That looks pretty good. So what I like to do is feel the facet. Let me have that. I think I'm a little low, right? Shot. Shot. That looks pretty good, right? I can feel it. So now you got to hold it here and not let it move. Can you do that? You got to literally hold it down and not let it move. So you bring this in like that, carefully, and then you literally have to hold it right here, pushing down. Okay, you're pushing down right here, and you're also holding the scope. So you literally have to dock it and bring the scope back a little bit, and there you are. Okay, and why is there no movement? Ah, there. And now bring your laser in. You know you're looking at the sidewall of the facet, right? That may actually be the nerve there. So go ahead. I'll hold this. You manipulate the laser. Now you got to push down with that laser. There you go. Not quite that much, but yeah, there you go. Yep. Turn it on. Yeah, it is stuck, but just turn it on and start clearing some of that tissue. Stay away from the foramen below. See the fat pad of the foramen? Stay away from that. Yeah. Stay to the, there you go. And push down. There you go. And come up. Stay. Oh, hold on. Let's inspect. You feel TP? Okay, then burn. As long as you feel TP, you're fine. The nerve is probably in there. Just do not come out with that laser and put your foot on the pedal. Now let's see what you've done. You got to stop every few minutes and inspect. Yeah. That looks like capsule, mostly. Do not, wait. Do not let that laser come on when your scope is so close, okay? Go ahead. There you go. Okay. And let's see, that's bone there, right? So looks like you're in the right place. Hold on. Do not come on when the scope is so close. All right, go ahead and burn some of that tissue. Yep, and go burn to the left. That north stuff. Oh, stop. Do not lift the laser and keep your foot on the pedal. Do you understand? You cannot do that. You gotta release the pedal as you start lifting the laser. All right, you're too high up there. I don't think that's anything up there. Here we go. Try that. Yep, that's what I want you to work on right there. Yep. Lift it a little bit, just a little bit to get that. Yes, a little higher to get it. You see, there you go. Nice. Now burn laterally. Yes. There, get it. There's the TP right there, right? So burn that lateral stuff. Because the nerve could be just a little lateral to the facet. Yep, get that stuff. Stop. That looks like scar tissue, doesn't it? This feels like we're on the facet. You feel like you're on TP? Yeah. All right, burn. That's a lot of scar tissue there from inflammation. Let's see what we got. Come up. Do not come on, but just come up. All right, let's try to get that stuff there. Down a little. Yep. Good. Right through there. Yep. That's all scar tissue from joint inflammation. Facet joint inflammation. Yes. Nice. Stop and inspect. Okay, do a little more and I think we're done. I want to try to go more lateral. Go ahead. Yeah, down, push down. There you go. Too far down. Come up a little bit. Go down a little bit. There, yeah. Now rotate to the left, counterclockwise. Yeah, yes. That area there, yeah. Good. All right, burn a little more. Let's see what we got. Let's turn it off. Off. That looks... Huh? I don't see anything else. Do you? Let me see. You see a nerve? The medial branch anywhere? I think we're probably good. The facet joint will be there. I would just burn a little right there. Yeah. Yep. On. see what you're doing. We got to see. Let's see. Come up. Yep. Let's see. I don't see any nerve. I think we've gotten it. It was all in that thick scar tissue. Did you do a rhizotomy?
Yeah.
So it didn't work.
I did after, I think before the laser.
Oh, okay. But basically, look at the scar tissue. That's probably why it's not working. All right, good. I think we're done here. Bring the scope out. Scope out, yep. A little medicine. A little happy juice. Take it out. All right, 2 down. And 3 more to go, right? 1 more on the left and 2 on the right. What was interesting about this last burn was that the amount of scar tissue you could see, all the white stuff from the facet joint. Scar tissue forms from inflammation. Inflammation is what creates scar tissue. The longer and more robust the inflammation, the more scar tissue that forms. So when you see a lot of scar tissue, there was either a lot of inflammation for a short period of time, or there was inflammation for a long period of time. But white stuff, white scar is mature scar. Mature scar means that it's old. It's been around a long time. Mature, like, older. Young scar tissue has granulation tissue, which is pink. So older scar tissue is white because it doesn't have any blood supply. It's basically avascular. It's just collagen. Layers and layers of collagen. So you know that white scar tissue has been around for a long time, years usually. And this patient has a lot of white scar tissue around that facet joint at L3-4 because that joint has probably been inflamed for a long time. And that's what causes the facet joint pain, is inflammation. There's actually a science behind pain, which most doctors don't understand. And once you understand that science, interesting. That looks like Bertolotti syndrome right there. Does it? Does that look like a weird transverse process? Huh? What? Yeah. Yeah, it looks like a giant TP that's articulating with sacrum. Is that what it articulates, or with the ilium? You can, yeah, it looks like Bertolotti syndrome there. Any questions from our audience so far?
No, sir.
All right, good. So for those of you who joined us late, we're performing surgery on the back. This patient has facet joint pain. Facet joint pain is very common. It's the second most common cause of chronic back pain. The most common being annular tear from a herniated disc. This patient's having the facet joints treated, L3-4, L4-5. How come we believe her facet joints are the source of her pain? You did a diagnostic block? So Dr. Patel did a diagnostic block where he numbed up the facet joints at L3-4 and L4-5 with Novocaine, and it actually took her pain away. But of course, Novocaine never lasts. It's going to wear off after an hour or two. And the pain came back. Now remember to hold it. Do not let it lift. Keep it there. Turn on your irrigation and bring your scope backwards. There you go. That looks pretty good. Just let him use the laser. So we're now at, I'll do this. You get the laser. There's just a little bit of fat there. Use the laser for the rest. So we're lasering Wonder what they're gonna say.
Well, I'm gonna try to fix it before.
There's no way you can fix that. How are you gonna fix it? Huh?
What are you gonna say? I mean, my concern is
Just tell them we're sending you back the scopes. But before we do, we want to buy some new ones or whatever. We want to buy these. However, we want you to. We think there's something wrong with one of the lenses. Not sure. Right? It's kind of like. I won't say it. Huh? No, it's just gonna. It reminds me of a story, which I'll tell. Fine. So, when this was back in 2004, and you still in the same place? And I took my wife to a place called Atlantis in the Bahamas. And what we really liked about Atlantis, we'd never been there, but we liked the fact that it has a water slides and a water park and fish and all kinds of manta rays and really cool stuff. So, but one of their key attractions is a giant water slide. You're too close with the scope. Do not turn the laser on. But you need to be on the TP. That looks interesting there. So we were so excited to go on the water slide. And she was actually just pregnant with my son, Arius. And her belly was starting to show, you know, I think she was like 3 months pregnant. So she was a little sticking out. So we go all the way to the top of this water slide, which you have to climb. And we get to the top, and the woman sitting up there looks at my wife and says, "Are you pregnant?" "Oh yeah." "Are you pregnant?" And my wife looks at me and says, "I don't know. Am I pregnant?" Because she realized if she said I'm pregnant, then they weren't going to let her go down the slide. And she really wanted to go down the slide. And I'm like, so she was trying to get my opinion on the moment, like, should we lie to her and tell her we're not pregnant? What's down there? Let's make sure you're on the TP. Let's go back and make sure you're on the TP. So I said, of course, yeah, you're pregnant. And of course the woman turned her around and I went with her back down the stairs. No, I wouldn't feel good about riding, you know, without her riding the slide. So I figured we'd commiserate. You should. You should. I haven't been there in 20 years. For me, I would go just to see the manta rays, you know, and they're. Scope on, please. You cannot let go of that tube. You have to dock it and keep it. Otherwise, you will never know for sure. You got to be a little more helpful on that. He's not going to be able to do that on his own. That's just an air bubble. Don't worry. You didn't destroy another scope yet. All right. What is that blurry spot there? You see it? See if you can poke it with a. What is that? Yeah, what is that? Is that a piece of schmutz there? It may be something out of focus. Why don't you take the laser out, keep your tube where it's supposed to be, and take the scope out, and let's wipe the lens just to make sure. You hold the tube. No, you cannot let go of the tube. You can never let go of the tube. You understand? You let go of the tube, then you got to start over with the fluoro. That's one thing I've learned about this procedure. Are you sure you're docked properly? All right, so let's look at this. Looks good. So it must have been some schmutz. All right. Are you sure? You don't want to recheck? You're good? Yes, no, maybe so? You're happy? Is that TP right there? It looks scarred. Is that TP? Yeah, that's TP. Good. All right, so I'll use the laser pedal, or you turn it on. Go ahead. Stop. That is TP. All right, I'm going to go medial, on. Off. More medial, on. Off. Wow, how are we so lateral in the TP? Or is that the facet? We need to know. You know what I mean? Because I keep going more medial. Scope off. You guys got to pay attention. When we take the scope out, it has to be turned off. Otherwise, you'll burn the light out. Coker. Shot. Well, huh? We're too south. Shot. Hold on. Shot. You think so? Where's the TP? I think we're at the top of the TP, right? Shot. I have a hard time seeing the damn TP. Do you see the pedicle? Huh, right? Am I at the bottom of the TP or the top of the TP? Oh, so this is that abnormal TP. Okay. That's probably why it looks so unusual. All right, fluoro out, bring the scope in. Scope on. Laser on, bring the scope back a little. On, on. Off. Good. On. Off. On. Off. On. Off. A little fat. On. Stay on. On. Off. Get closer. That's good. And on. On. Just hold the pedal down. Off. On. Off. Let's see. On. No, off. Come closer. Is this really all abnormal? Where is the lateral wall? On. Soft. Off. On. Huh? Off. On. Off. Is that TP? I mean, is that TP? Where is the facet? Shot? On? Off? You know what I mean? On? I mean, if this is all scar tissue around it, then certainly the nerve could be in here. Off? That feels solid. On? Off? A little closer. On. Off. Well, I think that's about it. On. Let's just do one more. Off. I think that's it.
Stop off, please.
All right, so 3 nerves down. 2 more to go on the other side. Yeah, you don't have to suck it. Just put it down there. It's fine. I'll hold pressure. You go to the other side. You're going to do it from this side, or you're going to do it from the other side, right? You're going to do it from that side. Hold on. Don't take a shot yet. All right, we're going to move to the patient's right side. And we're doing L4-5 on the right. Everybody agree? So it would be the L4 transverse process and the L5 transverse process. Pretty much done there. So right now Dr. Patel is using the AP fluoro to localize where to put the needle in. And the needle is going to go down to the spine, and it's too medial right there. He's going to go a little more lateral. You can see the facet joint. You want to be just lateral to that facet joint. You can see he's just lateral to the facet joint now. And you want to be kind of at the top half of the transverse process, lateral to the facet joint. That's kind of where he is right now. He's right at the top of that TP. Are you on the TP? You feel it? Perfect. Yeah, it's sliding. Any questions from our audience?
No, sir.
Do we have any local? You did it? On that side? Let me have local. Keep going. She's just responding to the incision. I don't know if I made it wide enough for you, but I may not. Let me have the knife. Let me see. Is it wide enough or not? Coker. I would just take the guide wire out and use the dilator. Shot. Bring the dilator down to the TP. No, just the dilator. It's on the TP. Shot. It looks good. I mean, it's a little south now. Shot. 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 I feel TP there, but it doesn't look right. Shot. Shot. I feel bone there. No, maybe not. No. Shot. Feels like it's slipping. There, that feels like TP. Shot. But it's too lateral. But I can't seem to get more medial. I feel like I'm hitting the facet. Shot? What do you think?
You always see that sometimes just shadows.
All right, go ahead.
Pushes to the top, yeah.
Hold on. See, it's pushed backward because of the soft tissue. Shot. That feels good there. Hold on. Shot. What do you think? Huh?
We just have to face this
That feels pretty good. Shot. All right, get the fluoro out.
Scope on, please. Thank you.
I'll hold this. You use the scope. I got the pedal. Or somebody else move the pedal.
Yeah, we know what it is.
Whatever you do, don't torque that stem. I need the scope on up there. All right. I'll do that. Are you happy with, yeah? I'm happy. I haven't moved, so we should be good. Get rid of some of that fat. Get your laser in. Bring your scope back a little. I can hold the scope if you want. Move your hand. Move your hand. Hold on. All right, I'll hold the scope. You do the laser. Do not, yeah. Go ahead. Go ahead. Huh?
Definitely on a bone.
Yeah. So get the bone to the south. I mean, get the soft tissues to the south. South, south, other way. Yeah, that way. Push down. And turn. Huh?
Solid.
Turn the other way. Yeah, that area. Do not lift that laser out. Mm-hmm. That looks like TP, right? So where exactly, go ahead. Let's see. That's good. I want to see, hold on, I want to see the facet will be medial, right? Right there. All right. Mm-hmm. Wait a sec. Wait, is that bone? Feel that with the laser. Now you're below it, right? You're in the foramen. Come out. So we need to be a little more north. Let's recheck.
Fluoro, please. Fluoro.
Scope off. Scope off.
Scope off, please.
Go ahead. Switch the feeds to the television monitor.
Fluoro, please.
So it's a little bit north, just a little bit. That's nice right there, huh? Do you feel bone? Let me, I move fluoro out. Let me feel it. Okay, I got it. Scope on. Come on, guys, stay on top of it. It's the same sequence every time. All right, go ahead. Good. Push down a little. Oh, not too much. Go down. Is that TP? That's TP. Do you feel TP?
Yeah.
Then go ahead and burn and come up. Yeah, burn down to that spot. As long as you're on the TP, you can burn. Hey, stop. Where's your 12 o'clock position? It should be, what is that other thing down there? That little marker. Yeah, I think that is a 12 o'clock. So you want to burn, see that bone? I think that's the joint. You want to burn a little lateral to that, right? Don't bend this too much. You'll break it. Let me see. This is medial, right?
Yeah.
So what is this laterally here? It's not really moving very much. It's definitely bone there. Think that's the mammillary process? Huh?
Looks like big one. That's why you see.
All right. Shot. I mean, laser on. It could be. Off, off. How's our irrigation doing, ladies? So then I get you more medial, right? On. Off. Why am I getting bubbles, guys? On. Yeah, we're seeing bubbles. Off. On. Off. Let's check our position again. Scope off.
Stop off, please.
Come in fluoro. Looks good. I think we're a little lateral to the joint, right? There. Try that, Sean. That's a little better, right? Maybe just a little more north. Shot. All right, let's bring the scope in. That's perfect.
Scope on.
Laser. That's got to be it right there. Just lay laser on. So let's finish this and we should be done. Because that's the junction of the TP and the off. And maybe just a little there on. No, don't bring the scope so close. Off. I don't see any more nerve there, do you?
Rita,
On.
steady strips, please, and bend soil, please.
There's going to be one more, we're done.
4x4.
Off. The only other thing we can do is go more lateral. That looks, I don't see any nerve there. More medial. On. Off. Oh, maybe that? On. Off. It's gone now. Off. I think we're done there. That's nice. The rest of that's capsule.
Scope off. Scope off, please.
Last one. Scope in. I mean, fluoroscope in. We already did. Shot. To me. Shot. It's fine. Tell, navigate him. All right, we've done 4 out of the 5 nerves we're supposed to deaden. These nerves are not the nerve roots. Don't be confused. We would never deaden nerve roots. These are nerves that go to the facet joint. You can see the transverse process just below the needle there. It's got a gray outline. It's a little higher, right? Other way, huh? You happy with that? All right, so we're right on the transverse process. We are just, knife, I'll get it. We are just, local. Just lateral to the facet joint. When you get on it, hold it there and I'll come in with the coker. Shot. Perfect. So now we've got our dilator where we want it. We're going to bring the tube down. We're going to do the whole procedure through a tube. Twist it on. I don't think you're all the way down. I don't think you're all the way down.
Huh?
I don't think you're all the way down. Are you?
Yeah.
You're on bone? Shot. Shot. Wait. Definitely was not all the way down. Let's try again. Shot. I think we're...
I was probably stuck on the pedicel.
Shot. 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 Right there. Think too medial or are we good? And I'm on bone. Shot. Bring the tube down. Good? Man, this really is a two-surgeon thing, you know? Oh, at least a two-person thing. Scope out,
Scope on.
endoscope on, fluoroscope out. Laser. Perfect. So it should be facing, come down a little bit. It's good. On. 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 Off. On. I feel like the laser is losing its effectiveness. Off. Let's get a closer look. On. Still doing the job, but I just get this feeling that it's not as strong.
Do you want a little bit higher? Or?
Where are we at?
20 watts. You want 30?
Yeah, let's go 30.
1 second, Dr. Patel.
Stop.
Stop. Put at 215. 215. 2 joules, 15 hertz, please. Yes. 1 second.
Let me know when you're there.
You ready? All right.
On. Why do we increase the pace? No.
Is that 2? Okay, so that's 30 watts.
Huh?
That's 30 watts.
Yeah, but I don't want increased firing rate. I want increased power per blast.
So then just to increase the joules.
Just do 3 and 10.
Yeah, 3 and 10.
On. Yeah, better. Off. Oh yeah, look at that. Oh, nice. On.
You like
Off.
to do that all the time?
I don't know. There's a lot of scar tissue here. On. I definitely like it for this. Off. On. A little fat. Gonna have to do a little fat emulsification. Off. Grabber. What is the next case?
It's similar 5 that was left. Yeah, only one side.
All right. Here. Let's get a closer look at that. Hold on. On. Off. On. Off. On. Off. Closer look. Closer look. On. A lot of scar tissue here. Off.
We have a question from Richard.
On. Shot. Yeah, on. Off. Give me a second. Back here. I think we need to relook at where we are.
Fluoro, Jordan.
Fluoro. Scope off. Yes, we'll take the question from Richard.
I drive a truck and I've been diagnosed with bulging discs in my C3, C6 along with T2, T3. I've been recently
Fluoro switch.
been experiencing some numbness, tingling in my hands and fingers. However, my surgeon doesn't think surgery is needed. Can I possibly get a second opinion?
Yeah, so if you have herniated disc, bulging disc in your neck, and you got tingling in your hands and fingers, there's definitely something wrong. Now, the tingling in the hands and fingers could be either due to the bulging disc in your neck, or it's due to a pinched nerve in your palm called carpal tunnel syndrome. Either way, you need a second opinion because your surgeon has dropped the ball on figuring out what's wrong. There's definitely something wrong, and it's easy to fix right now. So I would definitely get a second opinion. Get an MRI scan, or if you have one, get a copy of it on a CD and upload it to our website. Kevin, why don't you show them the link to the MRI review, free MRI review. It's mri.deukspine.com. And go ahead and upload your MRI, and we'll meet with you by Zoom and give you our recommendation for treatment.
Yes, sir.
Switch the scope. Be very careful putting it in. Yeah, there's definitely something wrong and fixable. Just so you know. You don't have to live with, no. What are you doing? I can't see anything. All right. All right. Go down a little bit. And on. On. Stay on. On. Off. Let me look. On. Off.
We have another question from
Thank you.
Mark.
Sure.
How are the transcending nerves roots get protected from this surgery? Do they get displaced by retractors? Is there any chance of injury?
You're moving. Well, great question, Mark. There's always a chance for nerves to be injured when you're doing surgery in the spine. But the nerves that you're talking about are not even near where we are. They're actually much deeper than we're working. So, and below. So they're kind of south and deep. Off. Let me see. On. 5 minutes, we're done. Off. That's the bone. On. Great question. Off. Yeah, the nerve roots are further deep. They're much deeper than where we are. On. Off. Grab her. On. Off. That thing's just getting in the way. So we're not really working at the area where the traversing nerve is. That's with the disc surgery that we do. When we do the disc surgery, the Deuk laser disc repair, that's when we have to worry about those nerves. On. Off. I need to see closer. What do you think? We're still in good position? On. Off. What do you think? I think we're pretty much done. On. On. There's the bone. I mean, I think we're good. On. Let's go a little lateral. Off. Let's see. I think we're done.
Come on, please.
Great questions. Thanks, everybody. Good job, Dr. Patel, Luis. You going to do the piriformis? So keep her asleep a little longer so we can do her piriformises. We could probably show the piriformis too, Kevin. That'd be kind of cool, because normally we don't get to show that.
Yes, sir.
You going to use ultrasound or x-ray? Dr. Patel will use X-ray, so yep. Good job, everyone. Go ahead and type up your questions for me, and I'll be there shortly to answer them.
Request a free MRI review. Who are we and what we do? With world-class physicians on staff, the newest and most advanced technology, Deuk Spine Institute has performed thousands of procedures and achieves a 95% success rate in elimination of pain. Treatments? Every patient comes to us with a unique set of challenges. That's why we address every patient's care individually. These are some of the world-class treatment options available at Deuk Spine Institute. Deuk Laser Disc Repair, Deuk Spinal Fusion, Rhizotomy, Epidural Injection, Kyphoplasty, Physical Therapy. Meet Dr. Deuk, world-renowned board-certified neurosurgeon. Go to www.mri.deukspine.com.
Muscles. They're deep to the gluteal muscles, right, Dr. Patel? The muscle, the piriformis muscle, attaches from the top of the femur over to the sacrum or tailbone. And Dr. Patel is an expert at numbing up, putting numbing medicine into those muscles, along with steroid, which is the proper treatment. All right, so we're going to clean up the buttocks. Can you see here, Kevin?
Yes, sir.
So the piriformis muscle runs across right through here, this area, on both sides. There's a left and a right. And what are you injecting, Dr. Patel? Lidocaine, marcaine, and Kenalog. And a little contrast, right? A little IsoView. That way you can actually see that he's in the muscle. Because if you just stick the needle in anywhere, you're not going to get the muscle. So Dr. Patel is going to make sure the needle's in the right spot. And to do that, he's going to use the X-ray machine. I've actually never seen one of these done before, so I'm going to watch as well and talk you through it. No, I'm good. I'm just going to stand behind Patel. So there's the femoral. Where is the muscle attached to? The femoral. That's where the muscle runs. That's what Dr. Patel is showing you. That black line is basically from the, what is it, the femoral head? Or the greater trochanter to underneath the SI joint. So basically the trajectory of that. Little skin numbing. And where do you aim for?
Right at the hip joint. Where the finger is like there.
The intersection of the hip joint and the what? Oh, between in the space? Interesting. And then you just go to, can you actually feel the muscle?
You feel the twitch.
Ah, you can feel a twitch. So I don't treat this because as a neurosurgeon, we don't really treat muscle issues. It's more of a physiatry, interventional pain management, diagnosis and treatment. Now what he's doing is injecting a little dye, and he's looking for the muscle. And if I'm not mistaken, you're going to see the entire muscle light up. There it goes. So now he knows he's in the right spot, so he injects the medicine, and there it is. Can you tell if there's a tear there in the muscle? No? You just know you're in the muscle. So there you go. He first does the dye, and then once he knows he's in the muscle, because he sees the dye spreading along the inside of the muscle, then he injects the medicine to treat it. Same thing on the other side, right? And the sciatic nerve would normally run below that, correct? The sciatic nerve? More lateral. And you can actually feel the muscle contract. Oh, so if it's more irritated from inflammation, then you feel it contract. So the patient's responding. Now our patient's still asleep, obviously. Is that the muscle? Amazing. Wow. That's amazing. There it is. All done, Kevin. So I'll come over there and answer any questions, okay?
Yes, sir.
Why don't you run a little video for the audience until I get there? But type up your questions for us, and we'll do our best to answer them for you. Okay, audience?
How to request a free MRI review. Who are we and what we do? With world-class physicians on staff, the newest and most advanced technology, Deuk Spine Institute has performed thousands of procedures and achieves a 95% success rate in elimination of pain. Treatments? Every patient comes to us with a unique set of challenges. That's why we address every patient's care individually. These are some of the world-class treatment options available at Deuk Spine Institute. Deuk laser disc repair, Deuk spinal fusion, rhizotomy, epidural injection, kyphoplasty, physical therapy. Meet Dr. Deuk, world-renowned board-certified neurosurgeon. Go to www.mri.deukspine.com. Click the Free MRI Review tab on the upper right. Complete the patient information form. Continue to fill out Step 2 of the form. Make sure to submit all your MRI images, plus report. You can submit the MRI through the mail, file upload, or medical record release. You can drag and drop or upload images into the form. Things to remember when submitting your free MRI review. All MRI images must be submitted along with the report in order for it to be reviewed. Once your case is reviewed by our team, a patient advocate will contact you. Thanks for choosing Deuk Spine Institute.
Dr. Deuk Majan here at Deuk Spine Institute, and it's Groundhog Day, I believe, right? February 2nd, so 2/2/2022. And I'm here with one of my patients who traveled from, where did you come from?
Tennessee.
Tennessee. And why would you travel from Tennessee to Florida to Deuk Spine Institute?
I have been miserable for months, and I found you and did a consult with you and knew this is where I needed to come for good treatment and relief.
And what kind of problem were you having that brought you to Deuk Spine Institute?
Severe lower back pain, which turned into sciatica, and it was down my left leg constantly. I slept about 2-3 hours a night at most, and I could not sit for more than 5 minutes, and I had to be standing up.
And did you try some other treatments in Tennessee or elsewhere?
I did. When this whole thing started and it was a bad flare, I thought I'll be able to work through this. Chiropractic, physical therapy, 2 spinal injections, massage therapy.
And how did you know those treatments did not work for you?
I had no relief at all. My sleeping continued to get worse, and my pain was never better.
And do you have relief now?
Absolutely. I would say I have 95% relief.
Awesome.
And it's amazing. After surgery yesterday, I put on a back brace. I walked out of here. I sat down yesterday for probably over an hour and had lunch. Last night, in bed, I had 0 pain. It's a miracle.
Well, we're very happy that you're doing so well. And your surgery was a great one because we fixed 2 discs. You had herniated disc at L4-5, L5-S1, and you can see in this footage right here that we grabbed the herniation out, and it was one of the herniations was really big, and it was really gratifying to get it out because it was resting on your sciatic nerve. Once we took it out, I think your sciatic nerve probably felt a sigh of relief.
Yes, absolutely.
Yeah, and the surgery went very well. The laser debridement of the annulus went well, and I feel like your pain's going to be gone. It's not going to come back.
I would agree.
All right, very good. Well, is there anything else you want to tell your viewers?
Folks, if you're suffering and you're not getting relief from those non-invasive therapies, then come see Dr. Deuk and have him look at your MRI and give a good diagnosis. And if you need to have surgery, you come down here. He will take good care of you, and so will his team.
I really appreciate that. Thank you so much.
Thank you.
I'm Dr. Deuk Majan. It's January 26, 2022, and I'm here with one of my patients who you underwent the Deuk laser disc repair on your lower back for some herniated discs about a week ago.
Yes,
How are you feeling today?
unbelievable. For almost 3 years, I had lower back pain, and it just, it just nags at you, wears you out. And then I came here, and you were the first one. I went to 2 other surgeons, and neither one of them picked up what was wrong with me, even though I had the MRI. And you came in, and you told me exactly what was going on, and you performed the laser surgery, and I'm like a different person.
Yeah.
A week later.
Yeah, you were a different person the next day, right? The day after, you had no pain, remember?
No, absolutely.
Yeah, so that pain's gone for the rest of your life. How does that make you feel?
New life.
Good. And, a long time ago, remember when people did something great, you said, what are you going to do now? They said, I'm going to Disneyland. You already went, I can see.
No, my wife's a big Disneyland fan.
Good for you. All right, so sounds like we helped you with your back pain, and it sounds like you're very satisfied.
Oh yeah, I'm recommending a friend of mine in Connecticut to come here. You have to come here. If you go anywhere else, I really think you're going to be wasting your time. So this guy just looks at you, and he can tell what needs to be done. He's a fantastic talent, and I'm very grateful that I came here.
Well, we're grateful you did too, because it's going to change your life for the better. Congratulations.
Thank you, Doc.
You're welcome. Treating a patient endoscopically with a new type of endoscopic procedure, and we call it an endoscopic rhizotomy. We were not the first people to discover the endoscopic rhizotomy by any means. It was taught to me by Dr. Anthony Young out of Phoenix. He was, I believe, a pioneer who started doing them endoscopically. Rhizotomy just means to cut a nerve, and there are nerves in the body that you're allowed to cut, and the purpose of cutting a nerve is to eliminate pain that's transmitted along that nerve. Think about nerves as cables, and if you're getting a bad signal through that cable, you don't want that bad signal, you cut the cable. Now, it seems kind of crude way to deal with bad signal like pain through a cable, but sometimes that's the very best we can do. And rhizotomies have been around for a long time. However, how we do the rhizotomy has evolved over time. And traditional rhizotomies are done with needles and a probe that the tip of that little needle heats up to about 80 degrees Celsius, and it burns the nerve if the nerve is nearby. The problem is it doesn't work that well. And so there are a lot of patients that have pain from their facet joint, and I'll show you what that is. That's the facet joint right there where the toothpick is located. Now, the facet joint is what's called the diarthrodial joint, and like any other diarthrodial joint, it has a cartilage surface, it has a joint space, and it has joint fluid, and it has a capsule around it called the synovial membrane. Now, these joints can be injured in trauma. So some type of a car accident or a fall or a sports injury, football, golf, you're actually smacking those surfaces together for a long time. It could cause traumatic injury to the surface of the bones where there's cartilage, and it breaks off the cartilage, and pretty soon you get inflammation going on in there because of the injuries. So one of the treatments for arthritic inflammation and pain coming from these joints, called facet joints, is to go in and basically deaden the nerve that goes to the joint. Now, if you look carefully here, you'll see there's a little stump of a nerve. That nerve came off. It runs right here near the facet, and then it goes up and innervates the facet joint. So a rhizotomy is where you come in right here and you kill that nerve by cutting it, burning it, any way possible. And what we did today was we brought the scope in, and we found that area right here, and we just used the laser to vaporize the nerve in this area. Now, sometimes you can't even see the nerve because it's covered in scar tissue from chronic inflammation from the joint. So that's what we did for this patient. We've got another patient we're about to do next, if you're going to stick around and watch. And this next patient actually has a fusion in his back at L4-L5. So his pain's not coming from the fusion, but it's coming from the joints above the fusion and below. So we're going to do a rhizotomy below and above the fusion. We're going to do that endoscopically. Now, his pain is on both sides. So the first surgery we're doing today will be on the left side. We'll bring him back in 2 weeks, and we'll do the right side. So we can't do it all at one sitting because it just takes too long. All right, any questions for me? No questions. You guys know everything. So anyway, if you get a chance, download the Deuk Spine Institute app. It's free. You have in the App Store on the Android or your iPhone, you just go to the App Store and you can find the Deuk Spine Institute app. Download it. It's got great information. Also, if you have somebody or know somebody that is living with pain in their back or neck and they basically can't get relief, have them submit their MRI for a free review. We do these weekly, usually on Fridays, from people all around the world. There is no charge for the MRI review. It's free. It's a community service. And just to help people get straight on what's going on and what needs to be done to fix their problem. Unfortunately, there's a lot of misinformation out there about spine problems, and people are being told all the wrong things. So we want to clear the air, make sure people know they have an opportunity to know exactly what's wrong with their neck or back, and that's what we do here at Deuk Spine, whether or not you treat here. All right, I hope you enjoyed the surgery. We'll be back in 30 minutes.